First here, Prevea Health is treating people diagnosed with COVID-19 who have lingering symptoms related to that disease.
Tonight, NBC 26's Eric Kress spoke with the system's chief medical officer about how their clinics are now designed to help identify ongoing symptoms and treat them.
Many COVID-19 cases come and go, but for many people, about 30% according to Prevea Health, the effects can linger for weeks or even months. And Chief Medical Officer Laura Nelson says those stats are even worse for those who end up hospitalized by the virus.
I was just looking at a cohort of about 300 patients who were in the hospital, and 70% of them, even 2 and 3 months later, continue to have severe fatigue. About half of them continue to have cough and shortness of breath.
Dr. Nelson says in an effort to help those with lingering COVID-19 symptoms, Prevea has now opened COVID recovery clinics at all of their primary care sites.
For instance, if people are having cough or shortness of breath, we can study lung function and perhaps target treatments to reduce the cough, get their lung function over time back to where it was.
At the clinics, Nelson says Prevea doctors will identify and try to offer remedies for COVID-19 symptoms that have persisted more than 14 days.
Some of them are saying, geez, I'm still no energy, or now I have insomnia or maybe chronic headaches.
According to Nelson, the ultimate goal at the recovery sites is treatment. And with an estimated 30% of her patients having some lingering effects, she says they're learning more every day.
I talked to a patient last week who had a cough and shortness of breath, and certainly with a few targeted treatments even that day with some medications, he was feeling much, much better.
In Green Bay, Eric Kress, NBC 26.
Eric, thank you. If you have experienced long-term symptoms related to COVID-19 lasting more than 14 days, Prevea Health has now opened their COVID recovery clinic at all of their locations, offering primary care.